Bienvenidos.
Hi, welcome. My name is Sandra Sarmiento. I'm a beautician, physiotherapist, and director of training at the company Delphine Therapies.
El objetivo de esta capacitación
The objective of this training is to know the anatomy of the buttocks, their alterations, and the correct way to perform the gluteal lifting treatment. Firstly, we must review the anatomy of the buttocks, recognizing the main muscles that shape the booty and how we can perform an ideal treatment for an effective lifting. Well, the most prominent muscles of the gluteal region are the gluteus maximus, gluteus medius, and gluteus minimus. These muscles, in addition to supporting the lower limbs, the pelvis and the spine, influence mobility and give stability to the body. Let's look a little further into the gluteus maximus, recognizing its importance in the buttock lifting treatment. The gluteus maximus. It is found in the superficial layer. It is a very powerful muscle, bulky, very thick, and very strong. It originates in the posterior part of the sacrum, which is one of the bones of the pelvis, and goes to the gluteal tuberosity, a bony relief in the femur. As for its function, it is the most important hip expander. That is, perform the movement of bringing the thigh backwards. Now, already entering into a aesthetic matter, the gluteus maximus weakens with age and lack of exercise, resulting in flaccid muscles and sagging skin. The flaccidity is another of the causes that makes the booty lose its shape. I will explain a little more on this subject. The collagen and the elasticin are the ones in charge to adhere the skin to the muscle. When these fibers are weakened, the gravity, overweight, and age make that the skin is stretched. We must understand that the therapist must objectively evaluate this condition to identify whether or not the patient is suitable for the gluteal lifting treatment. The most common causes of the appearance of flaccidity are lack of muscle tone, lack of cutaneous elasticity, excess of fat, severe weight loss, sedentary life, lack of exercise. Okay, understanding what is muscle tone and what is flaccidity, I present their classifications as mild, moderate, and severe. Mild corresponds to slightly loose skin and firm buttocks. Moderate to loose skin and slightly sagging buttocks. Severe, very loose skin and sagging buttocks. Delphine recommends only treating buttocks with mild or moderate flaccidity, since the sagging skin is very difficult to treat. These cases can only be rehabilitated through plastic surgeries with implants or lipo-injection. Delphine recommends that an ideal patient is one who has mild or moderate flaccidity, who also has an obesity index grade of maximum 1. In this way, the patient has the right conditions, which will allow thorough massage to mobilize the body fat and center it where it is most needed. In this way, dear students, I have completed the necessary knowledge about the anatomy and physiology of the buttocks and the possibilities of treating them. Now we're going to talk about the secrets for an optimal gluten lifting. The first secret of Delphine is to observe the buttocks of the patient and estimate the possible result. We should only sell treatments to people who have buttocks with a mild or moderate level of flaccidity and with average body fat. I want to take the opportunity and introduce Melissa, our in-house model. Melissa is a young woman with an ideal skin and a moderate level of fat to make this treatment a total success. I must clarify that this therapy is indicated for people between 16 and 50 years. Remember that everything depends on the quality of their skin and level of fat. Phase 1. Clinical record and results records. The first phase of this treatment is to fill the clinical record with the patient's data. It is ideal to make photographic records and a measurement with measuring tape. This information must be compared with the final result of the treatment. We must also specify at which point of the glutes we're going to do the massage, being recommended to fill flatter areas for lack of fat or that have lost their shape due to postural habits. With our beloved Melissa, we will observe areas for filling and marking of the gluteal crease. Pinching the compromised areas, muscle, localized adiposity, skin, and other alterations or areas to improve. According to the assessment of the patient, we can give a correct diagnosis and start with the gluteal lifting protocol. In phase 2, we have a second secret. Perform the mobilization of fat step by step. Okay, let's adapt the body molding cup to the equipment and start the program in massage, continuous mode, and medium or high pressure. The level of pressure depends on the tolerance that the patient has and the quality of their skin. The highest pressure is for young and resistant skins, whereas medium is for slightly sagging skin. Well, entering in material. We apply a thin layer of cosmetic oil on the entire thigh and glutes. We move the body cup with linear and zigzag maneuvers, intensifying the linear maneuvers since these are the ones indicated to displace the fat to the area that we have defined to fill. The Delphine Body Molding Cup allows you to have the perfect grip, thanks to its ergonomic design, which facilitates that you can do the massages in a vigorous and firm way. One of the reasons to improve the results. Then, and with the same purpose, we continue with maneuvers in number 8 and quick back and forth maneuvers in the direction of the glutes. Afterwards, we replace the cup with the therapeutic one, without the activating pin. We keep the settings of the equipment, and during 2 minutes we work the gluteal crease with sweeps. Directed to the center of the buttock. Then, and for 2 more minutes, we make spirals on the buttock, directed to the to-be-filled area. The third secret is perfectly adjusting the lifting cups where fat filling is most needed. First, we change the settings of the equipment to lifting or fixed cup. Pulsing mode and medium pressure. Then we connect the Delphine lifting cups to the T-hose and, in its turn, to the main hose of the machine. Verify that the pressure control valve is closed in a clockwise direction. Well, now we take the cups and adapt them simultaneously on the hip, and then move them to the area that was previously defined for the filling. We leave the cups for 20 to 30 minutes, doing their work in the area. By doing so, we achieve the filling, we center the fat, and we shape the gluteus medius. To remove the cups, insert a finger into the lower lip of the cup. Phase 3. In this phase, we must take advantage of Delphine's 4th secret for a perfect lifting, which consists of performing a spiral massage with the body molding cup for 5 minutes per gluteus, followed by a linear massage from the back of the knee towards the buttock. Remember that the maneuvers must be vigorous. After this therapy, we remove the excess of oil and prepare for the finishing touch of this protocol. which consists in the application of a cryomassage with the cold devices of Delphine. A therapy that allows to recover the treated area and tone the skin. I will apply the cold gel on the buttocks. If you do not have the cold devices, you can achieve toning by spraying a hypothermic spray. It is very important that you know that the result of this therapy becomes evident at the end of the treatment. And achieves its durability after the 9th session. The last and 5th secret that Delphine offers you is to complement this treatment with physical exercises. The use of sports panties, the application of the right cosmetics, and a balanced nutrition. I'm going to show you with Melissa how the exercises should be carried out. Our clients at home must perform 4 sets of 15 repetitions each day. It is preferable that this activity is done in the morning and at night. These are the exercises. Lying face down, the patient raises one leg backwards. On all fours, raise the leg flexed. squats. It is also important that our clients wear seamless sports panties that do not deform the glutes. As for nutritional recommendations, we should suggest the consumption of proteins, vitamin C, and natural fibers. Finally, recommend the daily use of a firming gel with a tensor effect. Well, now, let's review the times of this protocol. Treatment time, 20 sessions. The more sessions, more results. Time per session, 60 minutes. Well, my dear friends, Delphine thanks you for your attention and hopes that you will continue attending these trainings that aim to make even better use of your equipment and its wonderful cups every time. Delphine is unlike any other. As we say in Colombia, kisses and hugs.